So in the last lectures, you've heard important aspects before transplantation. In this lecture, we will discuss key aspects for transplant screening and also whether the patient can be put on a waiting list. So let's go to the patient. The patient is a 60-year-old male with a medical history of hypertension and diabetes mellitus. Because of end-stage renal disease, he is on hemodialysis for 1 year now. A renal biopsy was never taken. In his medical history, he had an appendectomy and also a basal cell carcinoma of the skin 5 years earlier, which was totally removed. There were no signs of recurrence or metastasis. The patient is a smoker. There is no living donor. So before transplantation, important questions raised regarding patient selection. Maybe you can already think of the answers. These questions include: so can anyone be transplanted? Why or why not? And which tests need to be done before transplantation? What are actually the selection criteria? And can this patient be put on the waiting list? We will first ask Professor De Vijter.
Hello everyone. Let's discuss some issues related to patient selection for kidney transplantation. First, landmark studies have indeed indicated that life expectancy is better with a successful kidney transplant. This included the elderly and/or those with diabetes. For risk assessment, first the age and the comorbid conditions should be taken into account. The pre-transplant workup of the 68-year-old male, a smoker with arterial hypertension, type 2 diabetes and end-stage renal disease should focus on cardiopulmonary risk assessment, followed by general information and education on the increased risk of infectious complications and malignancy, with a long-term need for immune suppressive therapy. In general, active infections or a malignancy without curative treatment are considered contraindications for transplantation. In addition, depending on the type and the grading of the malignancy, arbitrary observation periods have been defined. A treated non-melanoma skin cancer is not considered a contraindication for kidney transplantation, but may be taken into account while choosing the preferred drug combination for immune suppressive therapy. Before further discussing donor kidney options, in relation to the anticipated waiting times, we need information on surgical options for the vascular anastomosis. This is essential, and we will ask our surgeon, Dr. Huurman, to tell us about these issues to consider for surgical procedures.
A successful surgical procedure is key to make a transplanted kidney work. These days, many potential transplant recipients have a long history of medical and surgical problems. Our patient of today has had previous surgery, a potential risk factor. Furthermore, he is suffering from considerable calcifications of his large vessels, as can be seen here. The calcification occurs as a result of calcium buildup in the body and may increase the risk of complications during the operation. We measured the blood flow through his vessels, but this has not been compromised. For successful transplantation, the kidney should be attached to a part of the vessels where atherosclerosis is acceptable. Clamping of the vessels can take place with limited risk, and sewing is at all possible, for example over here. For every single patient, especially the elderly and vascular compromised, careful preoperative surgical screening and imaging are very important. This may lead to additional procedures to optimize the vascular system, but it may also lead to declining a patient for surgery. But in this case, luckily the patient can be considered fit for transplantation.
According to this evaluation, the patient can now be placed on the active waiting list. At this point, however, managing expectations by adequate patient counseling comes into the equation. There have been no live donor offers for this patient, and of note, a dialysis patient over 65 years and likely to wait 5 years has an approximate 50% chance of dying before a kidney actually becomes available. Given his age, comorbid conditions and current waiting times for a deceased donor kidney transplant, this patient should be informed and encouraged to accept the kidney offer from a so-called extended criteria kidney donor. and hope for a shorter wait. The remaining option is to wait a long time for a standard criteria donor kidney to become available. In general, mortality while on dialysis differs by age category. It also differs by country, but in the Netherlands is now approximately 4 to 5 years. In Europe, Eurotransplant plays a key role in the allocation and distribution of donor organs for transplantation. In this context, the Old for Old programs were actually designed to expedite the chance for the elderly to receive kidneys from older donors, with reduced waiting times. In the US, UNOS provides a vital link in the organ transplant process. In the optional part of this module, an illustration of how the allocation system works can be seen in the movie on the work of Eurotransplant.
So this patient received a kidney after 18 months of waiting time of an Old for Old DBD donor of 70 years. The procedure was uncomplicated and the patient had luckily a good renal function after the transplant. So what should we learn from this? Now, in the first place, life expectancy is better with a successful transplant, also in elderly and in patients with diabetes. Secondly, risk assessment is key, and this includes taking into account age, but also comorbid conditions. Thirdly, preoperative surgical screening and imaging are very important. And lastly, patient counseling is needed to manage the expectations. So what is the impact of the renal disease and the transplantation for the patient? And how is everything for the donor? If you want to find out, please have a look at the patient and the donor interview. So in the next module, we will discuss the challenged patients. In addition, you will find out the surgical aspects of transplantation. We have nice 3D movies which will help you to understand this.